doing these. I'm gonna have to invest in a better microphone. Really. Okay. Nursing and healthcare environment. We're running through all these, so it might be kind of long. A nurse with a hold on. Start over. A nurse with 2 years of med-surg experience organizes care efficiently and sets long-term goals. Which of the Benner stage is demonstrated? Novice, advanced beginner, competent, or proficient? Let's go through it. Novice, this is like a nursing student. This is someone who has no experience, doesn't know what they're doing, can't think critically at all. Advanced beginner, this is someone probably maybe like a year in. They have some experience, they're going, they know what they're doing a little bit, maybe their critical thinking's developed, but not anything. There's no organization, they're not setting long-term goals, they can't see these clinical situations as, big one picture. Proficient, that's the person who can see the clinical situations as a whole. They can think critically. Let me find the exact definition. They can do all the things that they need to do. And when I write in a notebook, I just grab a random page and there's no organization to it. It'll be a bunch of information and then 17 blank pages. Yeah, all my notes are in the very beginning. Just kidding. I don't have proficient written down. Of course I don't. It doesn't matter. The answer's competent. It's C. And I need to go fast because there's a lot. A nurse mentors a novice nurse and advocates for safe staffing best demonstrates which professional performance standard. A nurse who mentors a novice nurse and advocates for safe staffing best demonstrates which professional performance standard. Leadership, ethics, quality, collaboration. Collaboration, working together with one another. I mean, kinda. This is mentoring, though. Ethics, doing the right thing. Quality care. Safe staffing, that's quality. But this is leadership. This is a leader. Who's going to do that? Your mentor is going to be a leader. Safe staffing, that's leading. Yes, the answer is leader. Oh, here we go. Which Benner stage is characterized by holistic understanding and anticipation of clinical events? This is your nursing student, your person who can organize clinical situations and make long-term goals, your expert who is, doing that whole thing, just the best at everything, or proficient. It's going to be proficient, holistic understanding, and can anticipate clinical events. A nurse admits to a medication error to the patient. Which ethical principle is being demonstrated? Fidelity, veracity, autonomy, and justice. Justice is fairness. It's, giving the same care to the person who's in the top 1% of the socioeconomic world and giving the same care to the homeless guy who fell asleep on a storm grate thing and got burned on his face. Fairness. Autonomy, that is letting a patient make their own decisions. No, I don't want this med. I'm denying it. I don't want it, even if it's going to help me. Veracity, telling the truth. Are you telling the truth? Fidelity, making promises and keeping them. When you get married, you promise to be with this person forever and to not cheat on them. That is a promise to them. I promise to not cheat on you. What is it called when being cheated on? Infidelity. What a voice crack. So the answer is veracity. You're admitting to an error to a patient. You're telling the truth to them. You're not necessarily being fair. That's a really weird written question, but, it's the one that fits best. The Nurse Practice Act is enforced by, what is the NPA? Yes, it is the thing that makes all the nursing rules. Are nursing rules universal? No, they're kind of state by state. So there's your rule, State Board of Nursing. That's who enforces the Nursing Practice Act. Select all apply of professional performance standard. I saw that girl on YouTube who did the way that you answer NCLEX style select all that apply is you ask the question and then you go question or answer by answer and they become true or falses. Can this stand on its own as an answer to this question? So that's what we're going to do. Select all ANA standards of professional performance. Ethics, true or false? True. Education, true or false? True. Outcome identification. No, that's ADPI. False. Communication, true. Leadership, true. The answer is ethics, education, communication, leadership. Completing continued education credits align with which professional performance standard? Education, collaboration, environmental health, resource utilization. Okay, well, continuing education. It's kind of in the question. Yes, the answer is education. Revising a care plan after a goal was not met is an example of which standard of practice? Revising a care plan after a goal was not met. Is it outcome identification? Is it planning? Is it implementation? Is it evaluation? Outcome identification, that is the same one as diagnosis. I'm pretty sure. I don't actually remember. That's ADPI. Planning, this is what are you going to do after that diagnosis? This patient is at risk for skin integrity. What are you going to plan? Is the plan to turn them every 2 hours? Okay, now you're going to implement that plan. Okay, I'm turning them every 2 hours. Now I'm evaluating. I'm turning them every 2 hours, but it doesn't seem, they still have, red spots that look like they're getting worse. That's evaluation. Your goal was not met. You need to figure out what you need to do and go back to the top. Sorry, I got a notification. The ADA definition of nursing includes which elements? Select all that apply. We're going true or false. Protection and promotion of health, true or false? True. Optimization of health abilities, true. Prevention of illness and injury? I don't know. Which one of these is wrong? Oh, yes, that's true. Advocating for individuals, families, and communities and populations, true. Independent prescribing authority for all RNs, true or false. Can RNs give prescriptions? No. They can administer, though. Which word completes the ANA definition of nursing, protection, promotion, and blank of health abilities? I'll read them. Optimization, maximization, restoration, conservation. They all rhyme. So, if you know what ends in a vation, ation, or isation, you'll get somewhere. Okay, let's say it ends in isation. Promotion, protection, and maximization. Promotion, protection, and optimization. Clearly it's optimization. That one just sounds right. Which set represents the ANA standards of nursing practice? I'm not reading all this out. Come on now. ADPI. Which one of these say ADPI? Oh, I didn't even realize that not all of them say ADPI. I thought you had to put it in order. Okay, I gave that one away. But let's just think about it. ANA standard of practice, it should always be ADPI. Which best describes leisure versus certification? Leisure is voluntary, certification is mandatory. Leisure is legal requirement, certification validates special knowledge. Both are legal requirements in all states, both are voluntary. What is licensure? I'll give you a second. Yes, licensure is the NCLEX. You have to take the NCLEX if you're going to be a nurse. What is certification? Yes, it's APRN in a specialty. It's the advanced something. You're advanced in some sort of specialty. I'll do you one better. What is pre-leisure? This also, by the way, doesn't say leisure. It says licensure, but my brain can't do that. Yes, pre-leisure. That's ASN and BSN. Okay. What is post-leisure? Yep. Master's, PhD, the MP. Assignment. Oh, fuck, I can't read. Assigning resources fairly among patients demonstrates with which ethical principle? Autonomy, justice, beneficence, non-maleficence. Assigning resources fairly among patients. You only have 4 ventilators and 6 people need a ventilator. How do you do it fairly? Wait, how do you decide who gets what? You allocate those resources fairly. That's a really tough question. I actually don't know how that's answered. It's justice. Justice is fair. Beneficence is the urge to do good. That is giving patients pain meds when they are in pain. Non-maleficence is, not hurting a patient or doing something that's going to harm them. A non-English speaker receives an interpreter before ensuring a non-speaking patient receives an interpreter before consent demonstrates beneficence, justice, advocacy, non-maleficence. Yes, advocacy. You're advocating for that patient. And then which organizations develop standards of nursing practice and advocates for the profession? I mean, come on, we've only had 1,000 questions. That's right, it's the ANA. I actually couldn't tell you what the ANA stands for. Oh, the American Nurses Association. Okay, we're gonna do one more and then I'll cut this video in half. In delegation, the RN can transfer responsibility of a task, but retains accountability for the outcome, legal liability exemption, total control of patient care, freedom from supervision. Okay, those are terrible answers. Clearly one of them is right. When you delegate something, even if you don't do the action, you are still responsible for the action that is done if you did not do it with supervision, instructions, even just evaluating the patient afterwards. You're responsible. Which patient, can I read? Which of the following best defines the purpose of nursing theory? Provides I'm getting so frustrated. Provides specific rules for nurses, legal rules. Explains phenomenon in nursing and guides practices. Replaces clinical judgment. Establishes billing requirements. Okay. So I think we can knock 2 of them out. Obviously, it's not these 2. So provides specific legal rules for nurses. Explains phenomena in nursing and guides practice. Nursing theory. Clearly, this is the answer. It's the most what is nursing theoretical answer that they give. Which best describes the link between nursing theory and practice? Theory provides foundation for practice and generates further research. Theory eliminates the need for practice experience. Theory guarantees perfect outcome. Theory primarily defines legal regulations. Give you a second to think about it. I wonder if you just could hear me drink water. Let me know in the comments down below. Yes, A. Theory provides foundation for practice and generates further research. 4. The first step in evidence-based practice is after identifying a clinical issue is critically appraising the evidence, searching for the best evidence, formulating a PICOT question, PICOT question, implementing practice change. Yes, that is formulating a PICOT question, PICOT. And what does that mean? It means patient/population, intervention, comparison. Ooh, something in time. I don't remember what the L means. Which step comes last in evidence-based practice process? Appraising the evidence, evaluating practice change, implementing an interview, or forming peacocked. I'll give you a second. Yes, it's formulating peacock. Notice how I am not giving you rationale as to why the other ones are wrong. And the answer is, I don't know. I've never seen this actually before doing this. A nurse manager states, we will decrease catheter-associated infection by 15% in 6 months. This is a statement of nursing theory, quality improvement SMART goal, ANA standard, delegation principle. Well, what's a SMART goal? Specific, measurable, achievable, R, and timed. Yes, it's SMART goal. I don't know what the R stands for. A nurse leader compares staff adherence to hand hygiene policies before and after education. This reflects evidence-based practice, nursing theory, quality improvement, ethical decision making. Well, I would say if the hand hygiene goes up, that's quality improved. So yes, it's quality improvement. Because it's a goal. It's a before and after goal kind of thing with things that have changed. I just answered this question. Is every single one of these answers right? Is it not time? Oh, it's every single one of these questions. Actually, answers is right. Okay. Well, they're all right. So, PCOC stands for patient population, intervention, comparison, outcome, and time. A nurse implements a new fall prevention protocol on the unit based on recent research. This demonstrates traditional-based practice, evidence-based practice, nursing theory, quality improvement. Quality improvement, is there a before and after of improvement? No. Nursing theory, I don't know. Tradition-based practice, I mean, new fall prevention based on recent research. Recent, not traditional, recent. So yeah, clearly evidence-based practice. Nurse delegates vital signs to the UAP. The nurse remains responsible for collecting the vital signs, accountability for interpreting the data and responding appropriately, supervising the UAP on all units simultaneously, performing only complex procedures. I mean, obviously, at the end of the day, you're responsible for your patient. Which of the following best demonstrates presence in nursing practice? Charting while quickly sitting at the nurse's station, sitting at the bedside, making eye contact and active listening, delegating direct care to UAPs, completing tasks silently with no patient interaction. I fear that last one is so me when they're on a ventilator and I'm just chilling. Yeah, no, it's clearly sitting at the bedside, making eye contact, active listening. According to the delegation principle, which task is appropriate for the UAP? Administering medicine, assessing patient's lung sounds, taking a stable patient's vitals, teaching insulin administration. I mean, come on, this is a tech or a CNA. I actually unregistered. Is this just a tech? This is probably also a CNA too. You cannot administer meds. Can't assess. I mean, they don't even know what they're looking for. And then teaching education. So obviously it's taking vital signs on a stable patient. Now, if the patient's not stable, they just had a stroke and it's like, their first time eating after a stroke, UAP also would not be able to do that after that first feeding because it's the nurse's responsibility to make sure that, they're not pocketing food and that they're swallowing and all those things. So the patient has to be stable. A hospital, come on, these are the same questions over again. A hospital tracks infection rates before and after implementing a new hand hygiene program. This is an example of evidence-based practice, nursing theory, quality improvement, delegation. Yes, clearly, quality improvement. The quality has improved from before. There's two measurable times of data where it is a lower number or a higher number, or maybe the quality hasn't improved. A nurse forms a clinical question in hospitalized adults. How does hourly rounding compare to no rounding effect falls? This question is an example of evidence-based practice peacocked question, nursing diagnosis, quality measure, delegation principle. I mean, come on, let's just use our skills of elimination. No delegation. It's not measuring quality. And it's not, I mean, why would we even put nursing diagnosis up there? So obviously it's an evidence-based peacock question. Maybe it thought that I was stupid. Okay, true or false? Not true or false. Select that will apply. We're doing true or false. Which action demonstrates evidence-based practice? Using research findings to select wound dressings. True or false? True. Evidence-based practice using research. Consulting clinical expertise when evidence is limited. True. Ignoring patient preferences. False. Incorporating patient values into decision making. True. But does that do evidence-based is that evidence-based? Oh, I guess values are. Practicing only by tradition. I mean, come on. It's evidence-based. It's new research. So no. So yes, it's A, using research findings to select wound dressing, consulting experts when evidence is limited, and incorporate patient values into decision making.